Okay, I'm Shantice, this is Mandy, this is Tammy, and we're doing our project on lupus. So lupus is a autoimmune disorder that affects the immune system. Unfortunately, lupus is not able to tell the difference between foreign bodies and its own body cells and tissues, so it attacks its own cells. Um, the body systems that's included that is affected by lupus is the kidneys, the heart, the brain, lungs, blood cells, and joints. Lupus can also cause severe tissue damage and severe illness. And there's 4 types of lupus. So you have neonatal, which is commonly affects infants, which is a rare condition. You have discoid, which affects the skin. Systemic, which affects the entire body, the body system. And you have drug-induced, which is caused by certain prescription drugs. Lupus comes from the word, it's Latin for the word wolf. It mimics a wolf bite that a lot of patients get that has lupus on their face. In 1872, the 2 types of lupus was recognized, which was the systemic and the discoid. And the first case was reported in 400 BC. Most commonly affected people with lupus is women and children, and you'll see it most often in African Americans, Native Americans, and Asians. And there has been 1.5 million cases reported in the U.S. Lupus start by progression of overexposure to sunlight. Patients that have severe emotional stress can cause lupus, and certain bacterial and viral infections can also cause lupus. Sometimes patients get flare-ups if their lupus is not being treated properly, and that causes inflammation of the kidneys, the heart, pleuritis, and blood clots. And healthy lifestyle decisions can help limit the progression of lupus, but lupus is not able to be cured. Some manifestation of lupus includes fever, headache, loss of appetite, malaise, and unfortunately there is no defense for lupus because the autoimmune system is being attacked, and that is our body defense. And holistic care is when the nurse cares for a patient as a whole and not just the patient body, so that would include the mind, the body, and the spiritual needs. So a nurse can take care of a patient with holistic care, a patient that has lupus, by encouraging and treating the patient with dignity, promote ways to relieve stress, and also offer spiritual needs such as prayer.
Okay, lupus is kind of an intimidator. It's very challenging for physicians to diagnose it. It mimics other illnesses. It can come and go. It's very unclear, and it can change over time. The physicians will look at the whole body, all the body systems, what's going on with the bodies, the different body systems, particularly the joints, the skin, the kidneys, the lungs, the heart, the lab values. There's no single test that they can take to definitively say they have lupus. Again, just like the body system, they have to put everything together and see what's going wrong. They test for the antibody, the anti-nuclear antibody, the ANA. The patient's family history, and the patient's medical and family history is looked at. It's a recessive genetic disorder, so they'll look at aunts, uncles, grandparents, cousins, siblings, to see if there's any signs of lupus or any other lupus diagnoses in the family. There's multiple labs needed to help diagnose lupus. They have to, tongue twisted. Multiple labs have to be drawn because some can come out negative, some can come out positive. And another thing is other illnesses mask lupus. One definitive test, lab test that they test for that's common with lupus patients is the autoantibody, which is made against your body, and it causes inflammation, pain, and damage to parts of the body. Okay. There are 11 common signs and symptoms of lupus. You have the malar rash, which is your butterfly rash. You have the discoid rash, which is red raised disc-shaped rashes on the body. You have photosensitivity. Your body reacts to the light and sunlight. It can exacerbate skin conditions. You have oral ulcers. You have joint arthritis, which is joint arthritis, and they look at if it's affected multiple joints. You have serositis, which is fluid around your heart, your lungs, and that can cause chest pain. You have kidney disorder, which you can have protein or cellular cast in the urine, which is very, very common with lupus patients to have kidney disorders. You have neurological disorders. You can have seizures or psychosis. You have blood disorders. Your blood disorders are anemia, leukopenia, lymphopenia, and thrombocytopenia. And then you have immunologic disorders, your anti-DNA and anti-SM. You're positive for antiphospholipid antibodies. And finally, your anti-nuclear antibody is positive. Other additional tests is your CBC, just your regular normal CBC, protein levels, urine analysis. That can also check for kidney function. You have your blood clotting time test, skin biopsies, and your skin biopsies are mainly your skin and your kidneys. Nursing implications would be pain and discomfort, long duration. This is a lifelong diagnosis, and the patient has to deal with that for their life. Lack of exercise and ambition, and poor diet. Interventions and outcomes. The main one would be pain management. Lupus patients have a lot of joint pain, and they have to deal with that for the rest of their lives. And also with the pain management is you don't want them to be dependent on pain meds. You want other forms of pain management. Collaboration of care. Your patient with lupus, because it's lifelong, they're going to need community resources, community outreach programs, mental health, counseling, dietitian, and maybe a life coach to help them through this. And an exercise plan. You want to get them on an exercise plan that can keep them moving to help with the arthritis. The past treatments for lupus, the FDA first approved of aspirin, and in 1949, corticosteroids were introduced, and that was for inflammation. In 1955, Plaquenil was approved, and this is a anti-malarial drug, and it's for rashes, for fatigue, joint pain, and mouth sores, and etc. Present day treatments, there's an array of treatments and medications for lupus, and these were two of the newer ones that I found in the last year, and it's Benlyta, which is put into the veins to target a protein called B lymphocyte stimulator. It helps reduce the impact of abnormal cells. And then you have Artemisinin, and that is improves symptoms by reducing the levels of antibodies and protein urea. It also helps reduce renal damage, and it also reduces the use of patients taking prednisone.
Okay, so health promotion and disease prevention. You want to watch your patient for signs and symptoms, which is like the butterfly rash. Take their medication as ordered, so that way it's an even keel of medication at all times. It will help with the flare-ups. Have an exercise plan, because the more they exercise, even in like a regular arthritis patient, the more they exercise, the more of, less pain they will have. The more you move, have a healthy diet, because if you don't have a healthy diet, you'll have more flare-ups and more inflammation in the joints. Take breaks between activities, so if like they're feeling down and low and they're tired, then they need to take a break before they start another activity. Reduce stress is a big one, because stress causes a lot of the flare-ups. And wear sunscreen, because they are prone to the sun, and so they said that the recessive gene in a patient, if they have a recessive gene in a patient for lupus, then a lot of sun exposure will bring out that lupus, and that's how they originally find out that they have lupus. Teaching details. So there are 6 foods lupus patients should not eat. Red meat is one. It causes a lot of flare-ups. They want them to eat less trans fats and processed foods. The same way, most patients have to, like even a heart patient has to eat less trans fats and processed foods. It causes flare-ups, especially the salt in the processed foods. Avoid garlic and alfalfa, because that's certain spices that causes the flare-ups in the joints. Avoid alcohol and the salt because it helps hold water in the joints, and that causes inflammation. And alcohol because it's not good for you, and anything that's a foreign object in the body causes, flare-ups. So, foods lupus patients should eat. Fatty fish, like omega-3s, because that helps with the joints. That gives it lubrication for the arthritic joints. Food rich in calcium, because that helps with the bones. The patient did not cause this disease. A lot of patients think they caused the disease, and they did not cause the disease. Lupus is not contagious. A lot of people see that rash, that butterfly rash on their cheeks, and think, oh, this patient is contagious. They're not contagious. It's not a cancer. Some people think lupus is a cancer. It's not a cancer. Lupus will sometimes make you feel sick and depressed. Some of the meds, the side effects of the meds, make you feel sick and depressed. Lupus patients should get lots of sleep, plenty of sleep. Helps with, the stress, and help them with the inflammation of the joints. Use sunscreen and protective clothing to avoid flare-ups, because, if they have that gene in them and they keep getting these flare-ups, they keep going out to the sun, they should probably use sunscreen, because the sun brings it out in them. These are some of the medications. The Plaquenil is for mild lupus related to skin and joint disease, and the Cytozan is a chemotherapy drug that is used to treat severe forms of lupus. And psychosocial issues. So psychosocial issues, they feel depressed because they have self-esteem issues, some of them, because they don't want to go out of the house if they have that butterfly rash. People look at them, wonder what they have. They have anxiety, They are involved, it involves the nervous system. It can cause memory problems, difficulty concentrating, which is called the lupus fog, mood swings and confusion. Lupus causes the patient to be tired, feeling ill, causes stress, and that signals your immune system to cause inflammation. So anytime like they have this in their body and they're doing really good and they don't have any flare-ups, and then stress or the sunlight comes about and then boom, here comes a flare-up. So you have to avoid these things that cause these flare-ups to be more healthier. And 60% of patients with lupus suffer from depression because of the side effects of the medication. Sickness causes stress, that causes more sickness for a lupus patient. The patient needs to find a way to control their stress. So like exercise, a hobby, meditation, a support group, anything to keep the stress down. So the family or caregivers feel this also because they're in fear for their loved one or the person they're caring for, because they never know when they're going to have that flare up. So they should all talk to each other, be together in a conversation about how do you feel, what can we do to help you, let's make you this is the kind of meal that you should have, let's do some exercises, keep the stress level down in the house, the anxiety, and let your family or caregiver know the extent of your fear or pain. And there are support groups. There's many support groups. If I did look it up for Michigan, there isn't one for Michigan. I couldn't find one, but there is Facebook support groups. So if you go on Facebook, you could be on a web. And why a support group is important is because no one knows how that patient's feeling except the patient and someone else that has that disease. So if they were to go on a support group, something that a family member might not understand because they're not having this illness themselves, someone in the support group would understand, and it will help them get through this with a better experience. So now for the teaching part. So if I was a nurse that had a patient with lupus and I showed them this PowerPoint or went over all these teachings, I would then ask them questions about what they learned from this PowerPoint or the teachings to make sure they regurgitated the information to me correctly. And if they didn't, then we'd have to educate them a little more. So Shantice, what did you learn from?
I learned that you should avoid red meat, you should avoid trans fat foods, you should avoid sunlight, and you should avoid stress.
Mandy?
There's support groups on Facebook if you can't find any in your local area. Stay out of the light. This is a recessive gene. It's not cancer. It's not contagious. And stay away from stressful situations.
Okay, and so both of those answers were appropriate. So at that point, I would think that as a nurse, I gave the right teaching. And then I would at that point probably give them a pamphlet or give them a copy of this PowerPoint. So if they ever needed to go back and look at the information, they would have it on hand.
All right, and that concludes our project. Thank you so much.